How much does Medicaid spend on children and pregnant mothers? I asked AI to source public records and break it down. Here's what it had to say.
Medicaid is the largest source of health coverage for low-income families, supporting millions of children and pregnant women. Children's coverage. Children are the largest group covered by Medicaid, making up nearly 40% of all beneficiaries and costing about $115 billion annually for services like vaccines, checkups, and treatment for illnesses. Prenatal and birth services. Medicaid funds 42% of all U.S. births, spending roughly $60 billion annually on prenatal care, labor, delivery, and postpartum support. State and federal spending. The federal government covers 63% of these costs, while states handle the remaining 37%. Expenditure overview. Medicaid ensures access to vital services like routine vaccinations, prenatal care, and baby checkups, creating a safety net for families who might not otherwise afford health care. Gains. Early access to care reduces infant mortality rates, improves childhood health, and lowers the risk of developmental delays. Preventive care for children leads to fewer emergency room visits and reduced healthcare costs later in life. Supporting healthy pregnancies reduces complications that can be costly for families and taxpayers. Losses. Medicaid costs continue to rise with healthcare inflation, requiring more federal and state funding. And despite coverage, some areas lack sufficient providers accepting Medicaid, limiting access to care. Also, policy changes and debates over Medicaid expansion create uncertainty for beneficiaries and states managing their budgets.
Medicaid supports millions of families, especially kids. I'm learning so much about how it works. What do you think about this spending? Let me know.